names. One of its bone names is the hip bone. Easy to remember, the hip bone. Another name for it is the pelvic bone. Yet another name for it is the os coxa, or coxal bone. Either way. Okay? Now, when you are born, this is actually 3 separate bones. When you're born, it's 3 individual separate bones. The top of this bone is called, you don't have to know this stuff. This is just for, a historical view of the bone. Okay? Is the ilium. Okay? Ilium. Mm-hmm. And then the bottom back is ischium, the bottom front is pubis. So when they fuse into one bone, anything that was on the ilium in the adult bone becomes iliac, something or other. Anything on the bottom front becomes pubic, something or other. And then anything on the bottom half over here is ischial, something, from the 3 bones that fuse together. And this is the last bone in the body that does ossify or fuse together at the age 25. It's the last bone in the body to finish ossifying, which we'll get to when we get to bones. Okay, now, this, hopefully everybody knows at least this is the top of the hip bone. This is the very top of the hip bone. This thing's called the iliac crest. This is the iliac crest, and it tells you you're looking at the top of the bone. Iliac crest. Okay? Then this section right here, that faces kind of half anterior and half medial in the body. So we say this fossa here is called the iliac fossa, and it faces anteromedial, which is half anterior and half medial. Anteromedial, one word. Anteromedial. Okay? And directly behind the iliac fossa here is this roughened surface here, this entire roughened surface right here. And this thing has one of 2 names. This is either called the articular surface or the auricular surface. This is all in your handout. Okay, articular means to articulate or join with another bone, and it joins with the sacrum in the human body. And auricular means having a shape like an ear, and it kind of looks like an ear shape. So anything that's auricular means having an ear shape to it. Next thing you have to determine is the front from the back of the bone. Okay, a lot of different ways of doing it. Probably the simplest way, I think, is this structure right here. This fossa, and then this pointy thing here, tell you you're looking at the back of the bone. This thing here is called the greater sciatic notch, and this pointy thing is the ischial spine. That shows you the back of the bone. This is the posterior aspect of the bone. And then this section must be what? Anterior. And then you go back to the ilium. There are 4 spines here. And if you know this is the back of the bone, well, you know that this spine right here is the posterior superior iliac spine. Or you can abbreviate it PSIS. And then right below the posterior superior is the posterior inferior iliac spine, PIIS. And then these 2 are your anterior spines, anterior superior, anterior inferior. ASIS, AIIS. Clear? Okay. Next major structure right here is this large cup-like depression. It's called the acetabulum. Acetabulum. And you want to make that this always must face outward or lateral. The acetabulum must always face outward or lateral in the anatomical position. That becomes important later down the road. Right below the acetabulum is a hole. What do you call a hole in a bone?
Cavity? No.
No, that's a depression in a bone. What's a hole in a bone called? Did anybody look at that table with the bone markings on it that I asked you to look at? What's a hole in a bone called? A hole. A hole. No. So the answer to my question is no, Dr. Abdul. We did not look at the bone marking table that I was supposed to look at. The answer is foramen. F-O-R-A-M-E-N. A foramen means you're dealing with a hole in a bone. And there's one foramen on this bone, and there it is, and it's called the obturator. Obturator foramen. Okay? Okay, in case you're interested, the pluralize the word foramen. It's not foramens. Multiple foramina. One foramen, multiple foramina. Right? Plural. Next is the word ramus, a ramus. I don't like their definition in the book, so I will tell you a better definition. A better definition for ramus means a long, straight, narrow stretch of bone, a ramus. Ramus is a long, straight, narrow stretch of bone. And how would one pluralize ramus? Rami. R-A-M-I, rami. So there are 3 rami at the bottom, 3 rami at the bottom of the hip. And you can see this long, straight, narrow stretch of bone here? Does anybody see this?
Yeah.
Okay, what you have to do is put an imaginary line down in the center of it. What's behind it, right here, is ischial ramus. This is the ischial ramus. What's in front of that imaginary line is inferior pubic ramus. All right, so when you get back to your stations, right there, okay, there's an imaginary line here. If this is the ischium, this is the ischial ramus, and this is the inferior pubic ramus, right in the front. Okay, once again, this is the obturated foramen. This is 2 rami fused into one. The back part, and how can you tell the back? Remember, this is the back of the bone. So this is the ischial ramus. What's in front of it is inferior pubic ramus, which make this the superior pubic ramus right here. Superior pubic ramus right there. And then this big bump, where if you were sitting down you would be sitting, is the ischial tuberosity. Ischial tuberosity, this big bump at the back of the hip. Once again, this is the greater sciatic notch. Right below it is the ischial spine, and then below that is the lesser sciatic notch. Greater sciatic notch, ischial spine, lesser sciatic notch. And that's it for the hip. Any questions on the hip bone?